Hi there, welcome to another episode of Vision Quest. My name's Ashley Apap. I'm a writer and comedian from Melbourne, Australia, and this is my podcast where usually on standard episodes I talk to people that I enjoy about things that they enjoy, that's the way that I phrase it. But initially the point of this was kind of to have people come on and to have episodes where I talk by myself about things that I'm passionate about. And I think it's been a really great thing for positivity. I don't think that anyone's come on and kind of just ranted or raved about something that upsets them or affects them in a negative way. But I wanted this space to be open to that as a possibility. And on the day that I'm recording this right now, it is Tuesday, the 22nd of December in the year 2020. And when I'm releasing this, it will be Wednesday, the 30th of December. So almost the very end of this shithole of a year. Obviously, 2020 has sucked for everyone for a multitude of reasons. Number one being that there's a pandemic that has changed every single person's life dramatically on the planet, I'm sure. But for me personally, there's been a lot of huge changes. Ended a really long, serious relationship. I had to move out of my living situation because of that. I then had to move all the way back home because of COVID. Lost my job, lost my visa. Started this podcast, which has been really positive. Started doing more creative things. But one thing that has been an overarching stressor for me throughout the majority of my life, but especially this year, that I don't talk about much is my chronic pain. Basically, before I get into everything, I just kind of want to preface this by saying that I have a lot of trouble speaking about my chronic pain with anyone who isn't like very close to me. And I'll give a more kind of detailed explanation of why that is when I talk about some insecurities and things a bit later. But this year has really been the first time that I've even felt comfortable to tell anyone that wasn't my closest circle that I've been dealing with this stuff. Retrospectively, I think I also have put stuff on my Instagram stories, but often I feel like I use my Instagram as like a journal where I just like post stuff that I'm feeling and let it go and don't think about who's looking at it, which may be a good thing, maybe a bad thing. The point is, the first time that I actually spoke about this and how it's been affecting me, that actually kind of kicked off more of me discovering how much it has affected me, because I don't think I've actually given it as much credit. You know, I kind of have been trying to bury it and not think about it that way because I don't want it to be the thing that defines my life or defines me as who I am. But unfortunately, it is one thing that is not going to go away anytime soon and has been here for a long time. So I think it's time that I kind of explain what it's like to be living with this thing that's very normal for a lot of people, and also just give myself the space to talk about it without feeling ashamed or like someone's going to make fun of me or criticize me for it. The first time I spoke about this was at the beginning of the year. My old stand-up teacher in LA, Jude Shelton, who is the best, hosted a therapy open mic. I was doing a lot of gigs and open mics in LA that she had kind of put me onto and given me the courage to begin doing. And she started this therapy open mic where it was basically anyone can get up and talk about anything that they're dealing with, the most like difficult thing they've ever experienced to the most, trivial, like I cried because I dropped my coffee all over myself today. And there were people talking about family members that had passed away and relationships that had ended and really, difficult things. And I was sitting there, I remember in the car before I even got there telling myself like, I'm going to talk about my chronic pain. I'm going to talk about my arthritis, and like, it doesn't matter. It doesn't matter what other people are going to talk about. You are valid in talking about this. It affects you. And the second I got in the room and heard these people talking about these massive, massive losses in their lives, I was like, oh no, you cannot put your thing out into this space and compare it to what these people are going through. I remember saying to someone that was there with me, like, I think this is what I want to talk about. And she was like, do it. Like, you need to do it. That would be really hard. And I'm really glad that I did. I got up on the stage, and if you know me, if you've ever seen me perform or anything, I'm like the most comfortable when I'm on a stage, like more than a one-on-one interaction, more than by myself, more than anything. It's where I feel the most present and calm, and like I can be myself in the best way possible. I got up on stage, and for the first time, I'd say since I was like maybe 12, I was shaking, I was trembling, I was stuttering. I was so nervous to just be like, I have this situation that affects me and makes my life difficult in ways that it doesn't for others and does for others as well. And I found it so hard to talk about. And I think someone even pointed out, like, I've seen you on stage and you always seem so comfortable, but right now you seem like this is really hard for you. Even right now, as I'm saying all this, I'm like by myself in my room in like the safest space I could be for me. And I'm feeling kind of out of breath saying this. So basically that was kind of the catalyst of me being like, oh, the fact that I'm having this reaction means that I need to talk about this, and it could help someone out there who's experiencing chronic pain or has rheumatoid arthritis or psoriatic arthritis or just anything that affects someone in a way where they feel like, oh, I don't have the right to speak about this because it doesn't pale in comparison to what someone else is dealing with, which is not true. So today I'm going to be talking about my chronic pain, and these are the aspects of it that I'll be covering. And if you're watching this on YouTube, I'll have each section timestamped in the description below as well for you. So first, I'll be talking about my chronological journey with chronic pain throughout my life. Then I'll be talking about my current situation with my chronic pain right now and what life is like day to day for me. Then I will be addressing things that no one tells you about being in this situation. And I will be addressing insecurities that I have about my chronic pain and surrounding it, because I feel like that's the thing that holds me back the most from feeling normal and like other people will ever understand what I'm going through. And we're all human. We all experience these things. And I think being vulnerable and being open about our insecurities especially will make it easier for us to like let go of things. And because this year has been so bad, I really, really would like to be able to let go of this and not say that I never want to talk about it again or think about it or deal with it, but I don't want to pretend that it's not happening anymore. It's a part of my life and it's just normal for me. And I don't want to have to make excuses or constantly be considering what other people might think of me. I just want to put it out there and let it go. Then I will be talking about some tips for people who have chronic pain or have some kind of isolating disease that makes you kind of have these thoughts that I'm going to get into. And then I will just be giving out some tips for people who have loved ones with chronic pain. And before I keep going, I just want to say, like, I'm not an expert in this in any way. I'm not a rheumatologist. I'm not like a pain specialist or a doctor or a therapist even. This is just kind of me sharing my experience because, like, especially when I was beginning this whole process and looking into how I can deal with this and heal from it, as lame as that sounds. See, I shouldn't even say lame, that's ableist. As someone with a pension or disability card, I shouldn't be using ableist language, but here we are, one of the many things that I've been learning and growing through this year. But it's true, I didn't have a lot of resources to look to throughout this, and I found some really good ones as well. So I think at the end, I'm also going to give like a list of great resources that I've been able to find throughout me dealing with all of this. Let's begin. So my timeline with chronic pain has kind of been ongoing since I was quite little. I think when I was 8 years old, I realized that when I wore certain shoes, I had a lot of issues because I have really flat feet. And I think I remember being like 8 years old in the shopping center with my mum and my sister, and we would go shopping like for a full like 8 hours on school holidays. And within an hour, I would be complaining and needing to sit down. And my mum didn't believe me and just was like, come on, just stop complaining. Thinking that I was like unfit because I didn't want to walk around the shopping center. But what it really was that I was like, my feet are hurting so much. Now, all like after a few hours, then my knees would hurt and then my hips would hurt. And I was like, why is this happening? And flat feet runs in my family. It's very common as well, very normal. Not all people have like pain as a result of it, but I did. And so then when I was 10 years old, I had my first pair of orthotics and I did not listen to the doctors properly. You should be tying up your shoes tight. You should be wearing your orthotics in every pair of shoes that you wear. And when you're a little kid, even though it's uncool, it is smarter to wear more orthopedic friendly shoes. So then that way your flat feet will like actually change with the orthotics. And as you get older, you don't need them. But that's not what I did. Not blaming myself for my chronic pain, but I will blame myself for not wearing my orthotics properly when I had the opportunity to do so. Then a few years passed wearing my orthotics, putting them in like Vans when I'm not meant to be wearing Vans at all, and then not tying up the Vans, which is the stupidest thing I've ever done maybe. I remember I was 14 years old and I played a lot of basketball growing up. So that obviously contributed to some like joint issues as well, because it's lots of stopping and starting. And I was at basketball training one day, and if Joanna is listening, she will remember this because it was so funny to us at the time. We were at training, and all of a sudden, I felt something in my back that I'd never felt before. I'd never had any kind of back pain, anything. My knees and my feet were the main issue at this point in my life. So 14, at training, feel this weird twinge, and I just like instinctively was like, I need to lie flat on the floor. I don't know what's going on, but I can't be sitting or standing upright. And I like slowly lowered myself to the floor, and everyone in my team was like, what is happening? And I'm just laughing as I'm on the floor because I don't know what's going on, but this is where I need to be. My coach, my assistant coach, and a couple of the mums in the team had to like pick me up from lying flat because it was hurting so badly, and put me like on the chairs that the parents would sit on, and I was just lying there across like 3 chairs, and my friends were like taking photos of me on their like flip phones and laughing, and I'm just like, but also like this really hurts. And then I'd say consistently between like 14 and 22, I would have minimum like 2 back spasms like that a year, up to like 7 or 8 a year. So still not like impacting me every day at this point, but enough where it became a problem, and each one then became a situation where I would need to like lie flat on the floor for like 3 days straight and like sleep on a yoga mat to get it back to normal. And I couldn't exercise in that time. I couldn't stretch. I couldn't really do anything. Couldn't sit, couldn't stand, and just kind of like let it pass, which is annoying for anyone. But as a teenager, especially if you don't really have any like resilience or a high level of empathy for others, you know what I mean? I think I'm an empathetic person, and I was even then, but you know, teenagers are the worst. So I'm sure I gave my parents hell in those 4-day stints where I was lying on the floor. I remember once like lying there on the floor, watching an entire season of Pretty Little Liars in one sitting, and consuming an entire 2 tubs actually, of Ben & Jerry's ice cream at the same time. So, I mean, that's not a waste of that time in my opinion. So then between 14 and 19, there was kind of not a lot of change. Everything seemed okay, apart from like the isolated incidents where I'd have the spasms and like my general foot and knee pain. And then when I turned 18, 19, I started to notice this like very random seeming swelling in a lot of my joints. So in my wrists, my knees, and my ankles. And at the time, the person I was going out with, his mum was a nurse, and I showed her and I was like, what is this? Like, I haven't injured myself. I haven't been playing any sport where I've like knocked it or anything. And she said, it looks like inflammation. Like, it looks like this could be like linked to some kind of autoimmune disease. And I was like, what does that even mean? Like, the only thing that I knew about autoimmune diseases was like Lyme disease. And I was like, did I get bitten by a tick? What is a tick? What is a tick? Anyway, so that was when I went to my first rheumatologist. So basically a rheumatologist, from Google, I have looked up what a rheumatologist is so that I can give the proper definition. It says a rheumatologist is a specialist physician who has expertise in diagnosing and treating arthritis and other musculoskeletal conditions and autoimmune diseases. Arthritis mainly affects the joints, while other musculoskeletal conditions can also affect the joints, bones, muscles, tendons, and ligaments. So I went to see one of those guys, and this man was so dismissive and so rude. I understand I was 19. I didn't have any symptoms in terms of like the kind of pain that I have now, but I did have this swelling that just didn't make any sense. And so he basically said, okay, I'm going to give you this blood test where we test these cells in your body called ANAs. So the name of the test is the anti-nuclear antibody test. And if you have a positive ANA test, it usually indicates that your immune system has launched a misdirect attack on your own tissue. In other words, an autoimmune reaction. But some people have positive ANA tests even when they're healthy. So because I was 19 and I didn't have any crazy side effects apart from this swelling and my regular pain, which to me wasn't that high, but now thinking back on the amount of pain I've had throughout my whole life, my pain threshold is actually quite high. So I was going through like the beginning stages of my arthritis and I didn't know it. But because I hadn't explained that to the man and I thought, I'm actually not in that much pain, he dismissed me and said, no, there's nothing wrong with you. This test is an anomaly and you are one of these people that's presenting with a positive ANA test, even though you are healthy. So any other doctor, I think, would be like, okay, well, why don't we do the test again to check, right? And this man was like, no, you don't need to see me ever again. And I was really discouraged, but I was like, okay, he's the doctor. I'm a 19-year-old girl. I don't know anything. I have low self-esteem. Let's go with what he said, which was my first mistake. Then I think it was about a year later where the pain started to get worse and the swelling was kind of temperamental, but there was actually more pain and less swelling. And I decided, you know what, I'm going to go to a different rheumatologist because this man was so rude, had no information for me. I've got those test results. Let's go see someone else. So I went to this new person who is still my rheumatologist today. I showed him the test results. I showed him my symptoms and he said, okay, well, you know what? I think it's important that we do another test before we decide anything else. But it does seem likely with all the information that you're telling me that there could be something here. I don't want to write anything off, you know, like a reasonable doctor does, not like the other guy. In that test, like the other one, I had positive ANA results. So he said, okay, based on what we have going on here, which was the pain, the swelling. So he said, I think based on everything, it's psoriatic arthritis, which is much like rheumatoid arthritis, where your immune system attacks the tissue. So basically what it is your brain is sending signals to your immune system, so your white blood cells, and saying, hey, there's an issue in all of Ashley's joints. Let's go there and fix it. When really there's no issue, and my white blood cells going to my joints to fix the problem is actually what causes the problem and causes inflammation. So that's the way that both of the diseases work. But with psoriatic arthritis, it also usually is linked to psoriasis, which I have on my scalp. So that was how he determined that. And by this point, I had already begun my processes of trying to move to the US. So I was like, amidst doing that, kind of distracted, kind of not focused on my health, a child, you know? Then a year later, I'm 21 years old. I was about to go to Chicago for an improv course that was like 6 weeks and this big trip that I had. And right before I went, my back was getting consistently worse. So it had become more like every couple of months, I was likely to have a big spasm. So I then started seeing a pain specialist separate to my rheumatologist. And they basically said, look, we think that you've got maybe some joint dysfunction in your lower back, or this is all linked to the arthritis. And it's going to take some years for us to figure it out and trial and error. So the first thing we're going to do is give you a cortisone injection in your spine. So that was the first thing that I did right before I went away on this trip. I went on this trip and then I distinctly remember getting back in August and suddenly being like, oh, that trip was great. I looked cool in every picture. My outfits are cool with my shoes, but I can no longer wear shoes that aren't fully supportive and can fit my orthotics in them, which basically is only Asics. So funnily enough today, if you're watching this, you can see here are my Asics Gel Kayano 26s, very comfortable, very good. And I basically have worn a version of this shoe since when I got back in August 2016 and nothing else, unless it's been an occasion where I'm not having to actually walk on them too much since then, and probably will for the rest of my life, which is a good, fun time. But they are the most comfortable shoes in the world. They are the only shoes that I can wear where I have zero pain. Obviously, I have my orthotics in them. And these are new ones that I got. I have to get new ones probably at least once a year minimum because I do wear them constantly. I have a pair that I wear inside and a pair that I wear outside and when I do exercise, and we'll get into that more later. So then by that point in the next year, I would have been in America. So right before I went to move, my rheumatologist finally decided, okay, we need to get you on medication because while you're in America, there is no guarantee that you'll be able to keep track of this in the way that you can here. So that was when I started Plaquenil, otherwise known as hydrochloroquine, which yes, you may know as the drug that Trump said would cure coronavirus. Fun fact, it did not. It's a drug that's often used for malaria and for like arthritis type diseases. I was on it for 2 years. It worked, I'd say, for a year and then stopped working. Simultaneously, when I started that right before I went to America, I had my first ever radio frequency ablation procedure. So what that is, once again from Google, is a non-surgical, minimally invasive procedure that uses heat to reduce or stop the transmission of pain. Radio frequency waves ablate or burn the nerve that is causing the pain, essentially eliminating the transmission of pain signals to the brain. So every time I've had this procedure done, I love it because I come out, they have sandwiches waiting for me, I'm all drugged up. One time Scott Pendlebury was in there with me and apparently we had a chat. I don't remember it. My dad is the only person that told me that this had happened. It was right after Collingwood won a grand final. I don't really care about AFL, but my mate Scotty P, if you're out there, great times together at Metro Pain Group. Shout out. So like I said, that was right before I went to America, and that procedure, the first one that I had, was incredible and worked for a full year, where it took away my pain pretty much to the point where I could be sitting in a car for a full hour driving or just sitting in a chair without feeling even a twinge of pain, whereas my usual kind of no pain intervention status is within a minute, I need to stand up. So between 22 and 25, so the time that I moved to America and the time that I had to come back, there were not a lot of changes. After the year mark, that first surgery did wean off, and then I had to get off the medication because it wasn't working anymore. I had another surgery, I think, that worked for maybe a month. Then I had another one for about a week. But ultimately, between that time period, I had 5 different sessions of cortisone shots in my spine and 3 separate radiofrequency procedures done in my L5-S1 joint. So we get to this year. I got home in April and pretty immediately realized, okay, I'm back in the land of free healthcare. Let's take advantage of it. I need to get on new medication because I haven't been on medication in, I think, about 2 years by this point, a year maybe. So I think in April, May, I started methotrexate, which is a scary drug that if you take too much of can be lethal. They actually use it for abortions and things like that. And it is used as a cancer treatment drug. So I was on methotrexate, I'd say for maybe like 2 months. And it had very weird side effects for me where my sinuses got all crazy. I had increased pain and I was getting really mild but annoying headaches. So then we moved on to sulfasalazine, which was the worst experience I've ever had with a medication. I had a 2-week-long migraine to the point where I was throwing up, couldn't have the blinds open, couldn't look at anything, couldn't do anything. And basically, it's because sulfasalazine has sulfur in it, and a lot of people are allergic to sulfur, but you never know unless you have to have a medication with it in it, pretty much, which is exactly what happened to me. And then we moved on to where I'm at now. So, my current situation. Throughout that diagnosis of this year where I was trying those medications, my rheumatologist said, I think you have potentially a combination of psoriatic arthritis and rheumatoid arthritis. We're going to just treat it as if it's rheumatoid arthritis because all of these medications attack both. And the goal was always to get on this kind of drugs called biologics. Again, thank you, Google. Biologics work by interrupting immune system signals involved in the damage of joint tissue. Many newer drugs target a protein called tumor necrosis factor, TNF. These drugs are called anti-TNF biologics. Unlike other disease-modifying anti-rheumatic drugs, biologics affect immune system function. Basically, another way to say that rather than that mouthful of medical jargon is they're genetically modified proteins that go in and attack the inflammation really specifically. So there's a much higher success rate. And in order to get on biologics in Australia, you have to try all the other drugs first. So there's 4 tiers. The first one is Plaquenil, tried that. Second one, methotrexate, tried that. Third one, sulfasalazine, tried that. And then the fourth one, Humira, which is what I am currently on. So tomorrow actually is going to be my 4th installment of Humira, which means that it will be my 8-week mark. It takes up to 12 weeks for Humira to kick into the system. And it doesn't just treat diseases like arthritis, it also is used for Crohn's, ulcerative colitis. And the way that I'm taking it, it is a self-injector pen. So I have to stab myself in the stomach pretty much with this thing. It barely hurts at all. And I'm very grateful to actually have access to it. At the moment, I don't see any effects working yet, but you're meant to give it 12 weeks, like I said. So hopefully within a month, I will start to feel some relief from this drug. If I don't, then I'll just have to keep up with these following things that I do now, which are my daily routine, I guess. Every morning when I wake up, I pretty much have to stay in bed for half an hour to an hour, depending on how stiff I am feeling. The mornings are always the worst. So it is good if I exercise right away. A lot of people seem to think that it's too much movement is bad, whereas for me, obviously I think it's very different for everyone depending on their situation if they have chronic pain. But for me, as long as I am moving, I am good. I can't really sit. That's my main issue. So I have to exercise pretty much every day. some cardio and like something where I can move my hips and my back is the most important thing for me. Swimming is the best, but obviously swimming's not always accessible for everyone at all times of the year. So I'm very lucky to have purchased like a little cross trainer, and I use that pretty much every day, or going for walks is really good for me. At the moment, I can't really sit down for more than like 30 to 40 seconds without the pain really kicking in and needing to stand up and move around. So if I have a buildup of no exercising and more sitting than I should be doing, obviously sitting is not completely avoidable, especially now that social interactions are kind of back on in person in Melbourne. When I go out to dinner with friends, and just driving to have to get places has been really difficult for me. But I've been so excited to see people that I've just been doing it anyway, which can result in a buildup that leads to a spasm, which is kind of the situation I'm at right now. I'm having a flare up, which can happen if I don't do enough exercise and have too much sitting. Just say I do that consistently and don't do any of the things that are good for my body, I'll probably have like a back spasm where I'm out for a few days, once a week minimum. I've stopped eating any dairy and any gluten, as well as meat, because all of those foods can really contribute to inflammation. I say I've stopped doing it, but also I still will eat gluten when I'm not supposed to because I love bread, because bread is great, but I really shouldn't be because it contributes so much. So that's something that I'm trying to really be strict with to help the inflammation get down. On a normal day where I'm being as productive as I can, whether it's like seeing friends or hanging out with my family or editing the podcast or working on other creative stuff, I usually need to lie down like every half an hour, even just like 5 minutes. It'll kind of like reset me, and it really helps. And I'm now at the point where for pain relief, ibuprofen doesn't really work. So I try really hard not to have too much codeine, because that's kind of the only thing that helps with my pain at the moment. But sometimes I do need it. But as you all probably know, I do really think it's important to poo regularly. So I try not to take too much codeine, because it then affects that. And basically with this medication, like the others, it has some weird side effects that can pop up. So my specialist has advised me, while I am, living at home with my parents, we're amidst a pandemic, I'm immunocompromised, and I might be experiencing some weird side effects, to not work until the 12-week mark of this medication. So the end of January for me. So at the moment, I'm just kind of waiting for that until I can look for work. But simultaneously, days like today and yesterday, and a lot of random days that you can't plan for, make you realize like, oh, I have a disability card for a reason. I can't do things a lot of the time. And it's really scary to think like, oh, wow, how is this going to affect me in the future for how I might be like hireable or just relationships or anything. So that's kind of where things are right now. And now I'm going to get into some things that I feel like would be helpful to have known before all of this really happened, just to have in mind that kind of suck, that no one really is willing to tell you, and you kind of have to experience for yourself. But I do think it's important to hear, whether you are experiencing chronic pain or you just want to learn more about it, or you know someone with it. I think it's good to have the perspective that these kinds of things might be what the person in your life is experiencing, because they are hard things, and this is real life, baby. You can feel very isolated a lot of the time, especially like I'm 25, about to be 26. Let's not talk about the fact that aging still exists in a year that we didn't get to do anything. But anyway, a lot of my friends have normal, like mid-20s lives, and I try to have as normal of a life as I can as well, and often will like tell myself that everything's fine and act like I don't have this pain, and then it will result in a flare-up, and then it will actually be much worse for me. Even when you're doing the right thing and taking care of yourself, sometimes you can just start to feel isolated because you notice, I wish I could just like get up, get in the car, go to work, have a normal day like most people do, where they don't kind of have to consider, okay, you need to get like at least 2 hours of exercise in every day to feel limber. You need to like lie in bed for an hour. You need to avoid these foods. You need to do this. You can't really drive. At the moment, you can't work. Blah, 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 blah. So just understand that there is a lot of isolation that you can feel. And that doesn't necessarily mean that you like succumb to it and you're like, well, I'm just going to be isolated forever. I may as well just buy into it. It's more so that even when you're feeling good, there can be like a comparison that you do with other people, and that's natural, and it makes things worse, but it can happen. There are a lot more people dealing with some version of chronic pain than you even realize, whether it's like me, arthritis or like endometriosis or chronic migraines and so many more things, I have noticed that in trying to be more open and honest about this, especially on social media, a lot of people have reached out and been like, oh, I'm going through this thing where I can identify with all these things that you're feeling. And whether it's the same condition, which has happened, people have been like, oh, I have psoriatic arthritis too. And I've been like, I had no idea. I've known you for years. I had no idea you're going through this. And now we have each other to like talk to about it. Or it's people with something completely different, but they can relate. So that's like an uplifting thing that no one really tells you, is like so many more people than you think are going through a version of this and just like don't talk about it because they feel the same insecurities that I do, that I will get to in a bit. Sadly, people do kind of have trouble understanding exactly the ins and outs of chronic pain. I think depending on what you're going through, but for me, because it's like an invisible illness, and it's simultaneously being invisible and something that affects my day-to-day so much that like right now I can't work. It can be really frustrating to have people kind of like give you versions of pep talks where they give you ideas of things you can do to make things better. And it's like, no, but you really don't understand, which is hard. But simultaneously, like I just said before, there are people who understand. So I think it's kind of, you just got to be open to both of those facts. The worst is when people are like, why didn't you just try yoga? Or like, my uncle stopped eating nightshade vegetables and now he's completely better. You should do that. I've had so many people say things like that to me. And it's just like, I just hope you know, if you're one of those people, anyone you know that has chronic pain and their other friends that have chronic pain are just making fun of you behind your back. So just like, don't be that person, you know, because the specialists will help them figure it out. And often I feel like people's attempts to be there for you, which do have good intent, sometimes will come across as dismissive. So even though I was just saying I'll make fun of people who do things like that, it is coming from a good place, but you just need to like be aware that your reaction can't be like, oh, you don't get it, because then they don't get it, but they are thinking of you and like trying to help in the best way that they can. Something that I touched on before is, especially if you're young, often doctors will not believe you, or they will kind of discredit your pain and tell you that it's all in your head. So just be aware of that. That might happen. Not saying that's true of all doctors, but in my experience, it definitely happened. Telling yourself that others need you and kind of like what I said before, just acting like everything's fine and pretending you're not ill is actually going to make things worse and going to make you in more pain and going to like make everything worse for you. So you really do need to put yourself first. Even if you're not like a naturally selfish person, you have to find a way to realize that if you don't take care of your pain, you will not be able to be there for others. Any normal like routine or plan you had, whether it be day to day or for your whole life, you need to understand that it may not work out the way that you hoped it would. And you need to try and find a way to be flexible, because anything could change instantly, just like anything in life, obviously. But it's really important that you learn to be adaptable when you have chronic pain. You're probably not going to experience socialization the same way your friends will, which sucks, especially if you're young. I think it can like go both ways. If you've lived with chronic pain your entire life, which I haven't, so I can't speak to that, but I can imagine that it would just be normal for you. You would just learn that that's your way of life and you wouldn't know any different. Whereas like the real like thick of my chronic pain happening in my early 20s, I think has stunted me in a lot of ways and made it feel like I am growing at a different rate to all my friends and experiencing things at a different rate. And that's not true. That's not true at all. And I think like the ways that I've been able to grow and change are different to the other people around me that are my age, but they are just as valuable. So I think you need to just remember that as well. Even though you may not want to admit it, this one's mainly just for me. You do have to rely on others if you have chronic pain, and you can't do everything yourself. Like I said, you need to do the best that you can to take care of yourself, but there will be times where other people have to help you, and you need to be okay with that, because you're lucky to have people around you that want to help, you know? So don't shut them out. Don't tell them, no, I'm going to do this all on my own, because they're there for you because they love you and care about you. And physically, you can't always do everything for yourself. And finally, your mind is going to feel like held back by your body. So in my head, I feel like anyone else my age going through any other experience, but then I also have to like grieve my body sometimes. And I know that might sound over the top, but my therapist literally had to be like, you are grieving. You're grieving the loss of like what you thought your life would be at this point in your life, and like all these experiences that you were having and can no longer have, or that you had planned to have, and all this stuff. So you need to kind of just like remind yourself that your mind and your body are not against each other, and that it's okay to like slow down and remind your brain like, hey, this is just a situation we're in. We just got to slow down and deal with it, instead of being like, my body is the worst. This isn't me. Why is this happening to me? This doesn't make sense for me, but sometimes it's just how it is. And so now I'm going to talk about some insecurities that I personally have around my chronic pain and my rheumatoid arthritis and just all the things that are going on. I often think that no one believes me, that they think that there's nothing wrong with me, that I'm not deserving of like any help from the government, whether that just be like my medication is a little bit cheaper, or the acknowledgement that I have some form of disease that stops me from being completely able-bodied. Especially when I am a walking, moving person, it's really hard to tell yourself that you're not ill, because everyone can see you in the street looking normal. Like, I don't have like a disabled parking spot or anything like that, but I wouldn't even consider looking into that, because I'm so insecure that people would be like, you're cheating the system, there's nothing wrong with you, when there is. I'm definitely not at all comparing myself to someone in a wheelchair or someone that can't do things that I can do, like walk. I feel very lucky to be able to move and to walk, which is where all of this insecurity stems from. So just kind of wanted to make that clear, that it's hard to have something that people can't see. Not saying that it's harder than having something that people can see, because obviously there's prejudices and things that people kind of do, whether they realize it or not, around people who have visible disabilities. But it is hard to grapple with the fact that that's why I haven't talked about this for so many years, because I feel so worried that people are going to say that there's nothing wrong with me, or that they saw me like skipping yesterday, or they saw me like holding my nephew, like, you can do that, there's nothing wrong with you. And it's so hard, because it's really just day to day and depends on what's going on with my body at that moment. And so I feel very insecure about that. I also feel insecure that I'm talking about my pain too much, which obviously in this episode I definitely am, because that's the whole point. So I'm not going to feel bad about it this time. But like, one of my ex-boyfriend's mums, I remember once asking her, like, I had a really bad week and their family had been like helping me with stuff because I couldn't do something myself. And I said, like, do I talk about my arthritis too much? And she was like, honestly, yeah. And it does get annoying. And so I felt really, really insecure about it since then, because that made me think, oh my God, this person that I really trust and has done a lot for me physically, like had to be there for me in a lot of ways. And I was really grateful for that. But I was like, oh, I didn't realize it was like, I'm a burden to this person, and it made me feel really bad. I'm also insecure about like how it affects just like any interpersonal relationship I have, and that I'm like a burden on anyone, and that people have to take care of me and do things for me, and that I'll never be able to do those things for myself, which I know isn't true, because I do so much for myself. But it is really scary to think, oh my God, as I get older, if this gets worse and if I can't get a hold of this, I'm going to have to rely on more people, which goes back to what I was saying before, where you just have to rely on other people. And ultimately, I know that the right people in my life will be there for me in ways that I need them to, but not because I need them to, because they want to be there for me. So that's an insecurity I have to get through with my therapist. Another one is just speaking up when I'm in pain, even around the people that I'm closest to and trust, and who will actively go out of their way to be like, hey, are you all right now? Like, do you want to get a table when we go out to eat that's standing, so you can stand at the table instead of sit down, and things like that. And I'll find myself just automatically being like, no, I'm good today. I'm good. Everything's fine. I feel right as rain. I feel bloody ridgy-ditch, mate, when I absolutely don't. So I feel really insecure just about speaking up at all in those moments, because I want to be normal. Now, this one is like the most superficial and the least like pouring my heart out, but I think it's both very funny and really annoying. Is I feel so insecure about the fact that I have to wear ugly running shoes, even though they are cool. They are pretty cool. I did show you them. And if you're listening to this, you are missing out on the visual of my all black runners that I have to wear all the time. But man, my dress sense would be completely different if I could dress the way that I wanted to and wear shoes that I wanted to. Like, I would wear like giant platform shoes. I would wear like really cool, like hip runners and sneakers that everyone likes. I would wear like stomper emo girl shoes, which I used to when I could wear good shoes, and I miss those days so much. I would wear like slip-on shoes. I would wear cool fucking heels. Even though I'm very tall, like I would wear like literally every possible shoe you could wear except for these shoes. But like my style would be completely different. I think it would be a lot more like streetwear focused, and then there would be like some hippie vibes happening. It would be so different. But at the moment, and for the rest of my life, I say at the moment like anything is going to change. Basically, unless I get this reconstructive surgery on both my feet to make them flat, which has like a 6-month recovery for each foot, where you can't walk, can't do anything. So that may happen one day, but I don't know. Unless I do that, I can never look cool in shoes. And I know for a fact, there are people out there that judge people based on their shoes. Like, there are people that have outwardly spoken about that, and they're like, when I meet someone new, I will address them by looking at their shoes first and deciding what I think of them from that. And that makes me so angry, because I am like the least judgmental person about other people based on anything other than their like actions and behavior. And it makes me so upset to think that there are people out there that are potentially not giving me a chance, because I'm such a people pleaser and I just want people to like me, obviously, that could be writing me off as some soccer dad who wears runners and jeans because I have to. And it pisses me off. I just want to look cool. I just want to wear like the little Gorman heels and shit. And twoobs, twoobs. I want to wear jelly shoes. I want to wear fucking everything. I want to wear the weirdest stuff, and I can't, because I have to wear these orthopedic bad boys. But I am grateful that they exist, because they allow me to be able to walk at all. So there's also that. Now that touchy-feely bullshit is out of the way, I want to talk about some tips for people who are in my situation. Number 1, I would recommend always having an electric heat pad. So not one that like bubbles. There's one that you can get in a lot of chemists here in Melbourne that's like got water inside it and you heat it up and it's bubbling. No, go online, go to like Amazon, look it up. I think I found one that's a Sunbeam one. And then in America, I had a much better one that I can't convert the voltage for here. And I think I just got it from CVS. It's a completely flat mini heat pad that if you put under your back or wherever you're experiencing pain, especially for inflammation, you can like, the good thing about it, if it's fabric, you can like wrap your hand in it as well, or your joints. Having that immediate access to heat that doesn't go away like a heat up wheat pack would is very good and very life-changing and important. Another thing I would recommend is orthopedic shoes. You guessed it, but seriously, like even though I wish I could look cool, I'm so happy that I have found a pair of shoes that like works with what I need. And if you're out there and you have foot problems and you're just like f***ing them off to look cool, I get it. I really get it. But it is not worth it if it's going to affect the overall health of your like ankles, your knees, your hips, everything, your back. Like I can feel immediately after putting on a new pair of shoes that aren't orthopedic, like I'm not kidding, within wearing them for 30 seconds in a store, I will be like, these need to come off immediately. I can start to feel the pain in all of these joints going up my body. It's not worth it. Get some Asics. If you're in a country that has CBD oil available, I would highly recommend getting CBD oil to like put in your mouth just to have in your system, because it helps with inflammation, and also CBD creams. So you can get creams and ointments that you can put in your joints. And when my hands are feeling really bad and I can't like even hold my phone or like click anything on the computer, and like my hands are basically just have to stay limp like this, CBD cream oil was the only thing that really helps. It's kind of like has the effect of like Voltaren or Deep Heat without the stinky smell, and actually works better. Obviously, now I'm back here, so I can't get it, so I'm missing it. But when I was in LA, that was something that really, really helped me. So if you have access to that, I would highly recommend that. Like I said, cutting out dairy, meat, gluten, one of those options, all of them, I would say just try it out for like a month at a time maybe and mess around with it. Obviously, talk to doctors about that kind of stuff. When you mess around with food, that's very triggering for a lot of people as well. Don't make any changes without consulting a doctor first, but I think it really has helped me when I actually stick to it. For me, one of the issues I also experience is like skin issues and that can be really common with autoimmune diseases. So like right now I have this like rash on my neck. You can't really tell because I've done my lighting well, which is good, but it feels like scaly as hell. So just be aware you might have like skin flare-ups as well, and that's completely normal. Always have like some kind of like rash cream on hand, or like a hypoallergenic balm or something, because those can be really useful. Something that I've been doing for over a decade is in my backpack, I always have a little like material back brace, ankle brace, wrist brace, knee brace, at least one, always. You never know what's going to happen. And it's important. My ankle brace especially, like, because I can't sit down, I'm always either standing or lying down. So my feet, which already, as you know, have so many issues, get tired really quickly. And so obviously your ankles. Very important to have braces. Often autoimmune conditions can lead to more issues with your sinuses. I always recommend having peppermint oil on hand. I now rely on peppermint oil to be able to breathe so much that I like put it inside my nose. The other day I had a dinner for my friend's birthday and we were walking in the streets of Fitzroy. I pulled up my peppermint oil and someone thought it was like a thing to put cocaine in and thought I had cocaine. Didn't know that that's what people did with those things, but good to know. That's not what it was. It was peppermint oil. And then I put it on and everyone's like, man, that smells so good. So I was like, that's right. Fun fact, and you always smell good. If someone else offers to hold your bag or carry groceries, let them do it. Say thank you as many times as you can. If you need to let them know you feel bad, whatever, just let them do it if they are offering, because they want to help you and you need that help. Even though I made fun of the just do yoga thing before, yoga does help, and so does Pilates. Getting your core strength as tight as you can is really important. Mine is so bad, but I'd say for like 3 years between the ages of like 18 and 22, I was doing Pilates every week, and it was really, really helpful and useful. So I recommend that. Epsom salt baths, excellent. That's all I can think of right now, but if I have any more in the YouTube video where I post this, I will put some more recommendations in the description box. And now some tips for people who know someone who is experiencing chronic pain. Firstly, like, just be patient with them. Like I said before, like, you try not to be angry with someone or like take your frustrations out on other people if they don't get it, but it's bound to happen, especially if they're young. Like I said, when I was a teenager, I was a little as I'm sure all of us were. So yeah, just be patient, be as calm as you can with them. Recognize that any lashing out has nothing to do with you, and they are not actually upset with you or angry at you for not knowing what's going on, but ultimately you're never going to understand it unless you experience the same thing, and you just kind of need to be there for them and let them know, like, this sucks, I'm really sorry. Is there anything that I can do? And if they say no, then just be there in the way that they need you to in that moment. Your loved one may want to isolate themselves further, especially if they're already feeling isolated. It's this weird paradox where you're feeling a mix of FOMO and anger at the world and like, no one will ever understand me. So then you like remove yourself from everyone more, which is actually probably more harmful. But just wait and let your loved one tell you when they are ready for you to be there for them, because sometimes that's the case, and then other times they are just in so much pain that they literally need to remove themselves from everyone else and lie there and do nothing. And sometimes in that moment you can feel really vulnerable and you can feel just really mad and angry, and so it is best to just leave them be there for them however you can, but like listen to the boundaries that they're setting and what they need from you, rather than assuming no, they need me to do this, they need me to be this for them. Listen to what they're telling you, because they're the only ones living in their body, and they are the only ones that know what they need. Whether they are actually listening to their body or doing the wrong thing, ultimately you can only be there for them in the way that they tell you they need you. If you have the ability, obviously don't go beyond any of your own limitations, and you can, please be that person that offers to like carry their bag, carry the groceries, drive if they can't drive, whatever it is, whatever the small ways in which you can help them are. If it doesn't affect you, don't be doing anything that's going to make you build resentment towards them or anything like that, but just realize that there's some things that they're just not going to be able to do, whether it's forever or just momentarily. And it's really helpful when they have someone around them who's just offers to do it for them with no strings attached. On the topic of resentment, I can understand how people could build resentment towards someone who kind of needs things from you and can't give it back in the same way. And often, like, when you're going through the kind of emotional side of having chronic pain, it is hard to even figure out how you can give back to the people that help you, because you just feel really guilty and selfish, and it makes you just kind of spiral and feel worse about yourself. If someone you know is kind of going through that situation and you can see that they need your help, but they have no way of giving it back to you, maybe just like check in with them and reassure them and say, hey, I just want you to know that like, I don't mind helping you out. And if it's the opposite and you kind of notice someone asking too much of you, you also need to do the same thing and set your boundaries and be clear and say, I'm really sorry, I can't help you right now doing that. I have this work thing that I need to do, or I'm really tired myself. Don't exert yourself so much that the other person relies on you for everything, because not only does that then put you in a position where you might build resentment, it also then puts them in a position where if you are to be like, I don't want to do this anymore, I can't do this, they are then having to reevaluate, okay, how am I going to do all these things without this person who has been doing all of this for me? The most important thing is just like be open and honest and clear with them about how you can be there for them, and don't put yourself up to do every single thing. Just little things, one day at a time. I think something that's really important to remember if your loved one is experiencing chronic pain is what I said before, that you're never going to be able to really understand what they're going through, and saying things like, my joints don't really work as well anymore either, which is something my dad does a lot. And I know it comes from a really good place, but it's like, yeah, you're almost 60. That's fair enough. I'm 25. There's certain things that like people say in an effort to try to be comforting or reassuring, or kind of like, yeah, I've experienced that too. This is my way of showing you my empathy. And it can just be infuriating, and it shouldn't be, but it can be. I think the most important thing ultimately is just, before you say anything that revolves around your person's pain, just make sure that you're not invalidating it in any way or insinuating that it's not real or that it's not valid, because I think that, at least for me, can be something that's really triggering and makes all those insecurities come out. Really just like fodder for like a shame spiral. So avoid doing any of that. I'm not saying that anyone will or has that instinct, but it can happen even in the most like insignificant, innocent ways. So just keep in mind like that can happen. And if it does happen, that doesn't mean that you're a bad person or a bad friend or ally or family member or whatever it is. It just means that that person is having feelings and thoughts that are very normal for what they're going through. And finally, I would like to list 5 Instagram pages that I follow that seem to bring me a lot of comfort and joy in times when I'm struggling with my chronic illness. The first one is at The Mighty Site. There's a lot of like inspirational quotes and just things that kind of help you get through the day when you're having like a really bad time, as well as articles and links for things that might be helpful for you. Also things like 15 incredible disabled makers to support this holiday season, 12 antidepressant side effects we don't talk about. So they just talk about a whole range of things to do with mental health and physical health. Then there's A Safe Place Inside Your Head, which is a mental health nonprofit, which is like a combination of like fun memes and inspirational quotes and things to help you get through the day, and helpful little infographics as well. Like this one has different types of headaches, and it says, I've been crying for 3 hours and now I've got a migraine. Number 2 is thinking about my past actions and traumas. Number 3, haven't had water in days because of crippling depression. Number 4, when people tell me to just stop being anxious. So it doesn't just work for chronic pain. It's a lot of good stuff for mental health stuff as well. Then there's The Chronically Honest. So the artist who made this page does these beautiful illustrations with like quotes and things that she's feeling all regarding her chronic illness. So for example, there's images like this where it says, please don't forget you're worthy despite your limitations. And this one that says, unfortunately, no amount of positive thinking will ever cure this. Then there's a page called how.u.feeling, how.u.feeling, the letter U, not the word. And it says chronic illness advocates, mental health advocates. And it's all these posts of this one guy with this like letterboard. And he's written things like, you are allowed to be upset when it feels like your body has betrayed you. And things like, chronic illness has put me in a different stage of life than my friends. And then finally, there's chronic illness humor. Humor spelt the American way, so without a U. And it's just some good old-fashioned chronic illness memes. There's one here that says, me walking on a perfectly flat sidewalk, my ankle. And then it's got an image of McLovin from Superbad saying, let's show these fuckers how we roll. And then we've got this one where it's Homer Simpson all cozy in a bed, and it says, me recharging for 6 months after going out one Friday night. That was literally me after going to my friend's birthday dinner this weekend. On Sunday, I didn't move from my bed and I couldn't speak to anyone. Like a zombie. So I hope that this was helpful for at least one person, because then it will have been worth it. That's All I really want is to put something out there that will make sense for someone and help someone in the way that I kind of needed something like this in the beginning stages of my chronic illness and trying to figure out like what it all meant. So I really hope that this helps someone or just gives you a greater perspective of what I've been going through or what someone you know might be going through, and gives you some version of more empathy, and a deeper well of understanding to draw from. Like I said at the beginning, usually this podcast isn't about something negative, but I do want it to be open to people talking about things that they're passionate about in a negative way as well, because not everything in life is positive, if this year has taught us anything. And even though I want to be a funny person professionally, and that's what I do, I also am a three-dimensional human being who has more things going on than just making fart jokes and doing bits where I just like put myself down in a self-deprecating way. Trust me, those things are a part of me still. Don't worry, that's not going anywhere. But I think it's important to be authentic and honest, which was the point of this whole podcast in the first place. So I hope this episode was enjoyable for you, and I promise for the next episode that I do by myself to be something very uplifting and fun, and I know exactly what it's going to be. I'm not going to give any spoilers because I already have like so many episodes backlogged with guests, so I don't even know when it will come out, but my next solo episode, don't you worry, will not be as much of a downer. You can find everything that I'm getting up to, as always, on my social media at Ashley Crapapp. That's Instagram, Twitter, TikTok, everything, Twitch. I stream a couple times a week, so you can see me there. And I hope that the rest of your 2020 is wonderful and positive and nothing bad happens, and that 2021 is so much better than this year, because we all deserve it. We have been through a poo-poo storm of 12 months, and I really hope that for all of us, this coming year brings just some great, great, great stuff. So, mwah, happy new year to you, and stay hydrated. Bye.